Hello, this is Dr. Grande. Today's question is, what is melancholic depression? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss any new videos. When we talk about melancholic depression and we look at the DSM, we can see that what we're really speaking of is a specifier with melancholic features. That's the name of the specifier. And this specifier can be assigned to several different disorders, including major depressive disorder, persistent depressive disorder, and bipolar disorder. So melancholic depression is not a distinct diagnostic classification, rather just a specifier we see with other disorders. So in order for an individual to have that specifier assigned to a primary diagnosis, they'd have to meet the full criteria for that diagnosis and then additional criteria for the with melancholic features specifier. Now when we look at these symptom criteria, we see that the most severe part of the current major depressive episode is what we're looking at to apply the criteria. The criteria are divided into two parts, A and B. For Criterion A, we see that one of two symptoms is required. The first one is a loss of pleasure in all or almost all activities. And the second is a lack of reactivity to stimuli that would usually be pleasurable. So a lot of times when we think of this second criterion, we think of an individual who hears really good news, hears positive news, and doesn't react or only reacts a little bit for a few minutes. So again, just one of two of these symptoms are required for Criterion A. Now Criterion B contains 6 symptom criteria, and at least 3 are required. Number 1 is a depressed mood characterized by profound despondency, despair. Sometimes this is referred to as empty mood. Number 2 is depression that is worse in the morning. Number 3 is early morning awakening, so this is waking up in the morning before it would be usual to do so. And according to this symptom criterion, it needs to be at least 2 hours earlier than would be usual. Number 4 is marked psychomotor agitation or retardation. Now, with this particular symptom criterion, we oftentimes do see this one endorsed when someone has melancholic depression, when somebody would qualify for the with melancholic features specifier. Number 5 is significant weight loss or anorexia, and number 6 is inappropriate or excessive guilt. So again, with Criterion A, at least one of 2 of those symptoms must be met, and with Criterion B, at least 3 of the 6 symptoms need to be met. So there are specific characteristics that are associated with melancholic depression outside of what we see in the symptom criteria. We know that melancholic depression is more likely to occur in individuals who are having a severe major depressive episode. It's also more likely to occur in inpatient populations as opposed to outpatient, and it often co-occurs with psychotic features. We also know that individuals with melancholic depression are more likely to have a trauma history. Now, the concept of melancholic depression is not without controversy. It's been studied for quite a bit of time, and it's been assigned a number of names throughout the different research studies that have been published about it, including melancholia, psychotic depression, typical depression, endogenous depression, autonomous depression, and core depression. There are a number of individuals in the research community that believe that melancholic depression or melancholia is a distinct category of mental disorder, that it should be a distinct classification in the DSM and not simply a specifier that we see assigned to a primary diagnosis. However, of course, as it stands now, it's not recognized as a distinct classification in the DSM, but it is an important specifier to diagnose if the criteria are met, because it can inform treatment selection. I hope you found this description of melancholic depression to be interesting. Thanks for watching.